Hello there, welcome to my doctor show. Today we want to talk about asthma in children, and if your child has not been affected by asthma yet, then you should count yourself lucky because it's really an epidemic. Now, World Health Organization states or estimates that about 235 people worldwide suffer from asthma. It goes ahead to report that chronic asthma is the leading cause of death among children. Now remember, asthma is not just a health disease that affects high-income countries, it as well affects the low-income countries, and actually 80% of deaths that are as a result of asthma affect people living in low-income countries. So that is what we want to talk about, and remember, the best defense for asthma is prevention, awareness and early detection. We have in studio an expert who will be taking us through managing asthma in children, and you may want to be part of this discussion by either asking us a few questions or your views. You're welcome. The number to use to call us in will always be displayed right on your screen. The SMS line is 20268. You can also tweet us at Ebru TV Kenya. The hashtag is MyDoctor. Remember to also talk to us through our Facebook page. We are Ebru TV Kenya. Okay, first we want to look at what's coming up, but then we will request you to just sit back, relax, and learn from this exciting show ahead. My name is Purity Musel, and this is My Doctor Show.
In Kenya today, we're having a lot of cases of asthma that are rising throughout our country. What used to happen about 10 to 20 years ago, Purity, is that you would see a lot of trees in Nairobi. Now you're seeing high-rise buildings, 8-story, 9-story, everything is close and tight together. So now the children are not running out to play. They are stuck indoors. There are no trees that are going to, detoxify the environment that we are living in. The industrial areas are growing. Nairobi city is expanding rapidly. So asthma has now also carried on with that as well, and is also rising throughout the city. When I started working in chest medicine about 10 to 12 years ago, I'd get hardly maybe 1 or 2 new patients in a day having asthma and diagnosing asthma. And I'm talking about children who are 0 to 5 years of age. But today in our hospital here, we are seeing maybe 10 to 12 new cases per day. And that is just like one person, one hospital, one institute. We still have a whole country. There are other hospitals as well. There are other cities in Kenya and in East Africa as a whole. So to answer your question directly, it's rising at not in even a small space, it's at an astronomical space right now. And we are very, very worried as medical professionals that this rise has gone on for too high, too long, and there's nothing that's really curtailing its spread as we speak right now. Asthma, we can summarize it as an allergy of the chest. So you have these children who breathe in things from the environment. There's a lot of smog, there's a lot of pollution. So these things, they are entering into the lungs and the pipes of children's chests, and it's causing them to wheeze and to cough, especially at night. The average parent, Purity, will turn around and say that my child gets this cough and cold and it tends to stay for a little bit too long. You and I have got many coughs and colds in our lives. They'll last 3 days, 4 days, and then it disappears. But for the asthmatic children, it tends to last a very long time, 10 days, 12 days. The parents will come and say that my child coughs a lot at night, or when the child runs and plays. And then significantly, the fevers are usually just mild and gentle. They're not very, very high temperatures that the child gets. And then they talk about this congestion and strange sounds that come from the chest of the child. And those are one of the signs of asthma. In fact, we have a common Kenyan saying that my child has played so much that my child has started coughing. That is actually not true. When you see marathon runners who are winning marathons, they're not coughing as they run across the finishing line. So if you have a child out there who's coughing, when he runs and plays and it's happening on a repeated duration of time, like frequently, then that is also a sign of asthma as well. And then a lot of these children will have skin allergies, which we call eczema. So when you look at their hands, especially over here and behind their knees, they tend to be very rough and dry. Their mouths tend to be open a little bit because their nose is blocked most of the time. And then if you look under their eyes, they look like they have a little purple hue, as if like they've not slept well. Us as adults, we say you've not had a good night's sleep, and then you get a little bit of purple swelling under the eye. Now, if you see that in your 3-year-old, 4-year-old, And remember to match it with what I talked about earlier. This child who is coughing repeatedly for 10 to 12 days. He coughs when he runs and plays. When it gets a homa, it stays for very, very long. Now those are the signs of asthma. And I think a lot of us are missing that. We think it's the common cold. Then 2-3 weeks later, when the child gets another cough and cold, then we think, oh, this is another homa happening again. But that's not the case. In the land of medicine, we can do a lot with inhalers to help them. An inhaler delivers medication straight to the chest. There are parents out there who fear inhalers. And they'll tell you, Purity, that, oh, inhalers are addictive, they're bad for my child, etc. But that is not true. These inhalers are very safe. As medical practitioners, we are not going to lie to you. When a patient has cancer, we'll tell you, look, that cancer therapy is very bad, it's toxic, it'll do X, Y, and Z. You know, we share with you honestly. But with inhalers, they don't have the same side effects or addiction as people claim in our society. So that's something that the mothers need to be aware of. When you drink a medication, Purity, you drink, it goes to your stomach. From the stomach, it goes into your bloodstream, and then it goes to your entire body, to your head, your hands, your thighs, your legs, your kidney, your liver, etc. So to deliver medication to the lungs, I have to give you 100 medication parts to get 1% to come to the lungs. But if I was to give you an inhaler, I give you the one part straight into the lungs, so you avoid the 99% intoxication that your patient is going to have. No mother or father wants to hear about side effects of medication. So when you give a syrup for asthma, know that you're giving 99-fold higher the amount of drug, which will also equal 99-fold higher the side effects of the medication. So for the mothers and fathers out there listening, they need to know that it's easy to diagnose. There are no blood tests and x-rays that are necessary. You just need a good clinician to listen to you, examine the chest, and know that you have an asthmatic. Then they give you these inhalers that you use for a duration of time. And with the inhalers, you see almost virtual magic happening. I mean, I have parents who will come to our clinics 2-3 days later, and they're crying, Purity. And then I turn around and I think to myself, hey, I've hurt this child, I've done something wrong. These are tears of joy. The parents see magic happening within 2 to 3 days. And the average mother will come back and tell us, Daktari, we woke up at night to shake our child because we thought our child had passed on. But it's just that the child had such beautiful, peaceful sleep because for once the chest had been decongested appropriately with the right inhaler at the right dose, etc. If I can answer in 2 ways, if I take you back in Kenya 10 years ago versus today, the overall numbers have definitely increased. We don't have clear data, so I can't swear by a particular number. So one is that we're definitely worse off in Nairobi and in Kenya than we were 10 years ago. Second, you will always have waves that come in a particular year. So you are right. Look at this crazy weather that we have around us right now. Everyone is wheezing, everyone is breathing fast, you know, amongst the children who have asthma. And so in these seasons, you will always have a flare-up. So you have to be very careful right now. If you have a child who has asthma, they could trigger in this kind of weather that we're having right now. So viruses, in this particular case, is what is causing the flare-up. In order to prevent asthma and asthmatic attacks, you have to first correctly identify that your patient has asthma. So those things that we talked about earlier, identifying that this is not just an ordinary child who has an ordinary homa, but that this is a child who has asthma. So you need to make sure that the patient has asthma. If you have asthma, then you need to understand that you need to keep away from situations that is now going to precipitate all that. So if I take your child to a classroom full of coughing children, you're going to get into trouble. Now, to tell a mom, and I mean this with no disrespect to the moms who are listening to me today, but if you have a child who's sick and you allow the child to go back into a classroom of healthy children, you're spreading the infection. But a lot of parents are also working parents. So it's so hard. Who's going to look after my child at home? Watch out, let Mtoto just go back to school. But we need to also understand that when your child is sick, don't send your child to school for a couple of days. Let the infection go down. And that is not just for asthma and viral infections. This is for diarrhea and vomiting, etc. To prevent asthma is very hard. You need to find out what triggers it. So sometimes you might have a cat and a dog in a house that trigger it. Even cockroaches can trigger asthmatic attacks. I know that one always puts a smile on moms and dads and like, How can a cockroach trigger my asthma? And in thunderstorms, like we are having these kind of thunderstorms in Nairobi, there's something in the land of medicine called thunderstorm asthma. So the pollens are liberated into the environment and children start breathing in these pollens that they weren't doing when there was no thunderstorms. You understand? So with thunderstorm asthma, you also get lots of flaring of children who don't get it, who would otherwise be healthy.
All right, and to help us discuss more about asthma in children, it's a pleasure to welcome Professor Elizabeth Obimbo Maleche. She is a respiratory and pediatric expert at Hurlingham Clinic here in Nairobi. Welcome so much to my Dr. Show, and thank you so much for coming.
Thank you.
All right, much has been said following that clip that we've just seen, but would you break it down for us what asthma really is? When we talk about asthma, especially in children, what are we talking about?
So asthma is a condition where the chest of the child is oversensitive to certain triggers or certain things in the environment. And some would call it a chest allergy. So what happens is that when their chest is exposed to certain things that it's very sensitive to or it's allergic to, it overreacts and starts to produce more mucus than normal, and it starts to get, the lining inside the airways starts to get swollen, and the child starts to cough. And as the lining gets swollen and the airways become narrower and narrower, the child may begin to wheeze. And so what happens is that with the exposure to that trigger, the child, now you hear them coughing, then wheezing, having difficulty in breathing, saying my chest is paining or my chest is too tight, I can't breathe freely. And it may last for a few hours. Or if it's a very severe episode and the child is continually exposed to that trigger, it may last for several days and become very severe. Not all asthma is due to allergy to things in the air. Usually common things are house dust mite.
Right.
This is a little tiny insect that's present in dust, especially in houses. Other triggers could be pollen, grass pollen, tree pollen.
Right.
Other triggers could be chemicals in the atmosphere like diesel fumes. Diesel fumes, cigarette smoke, even fumes from kerosene stoves, inhaling those kind of things. This child's chest reacts vigorously against these chemicals which it doesn't like, and you have the symptoms. So it's usually they have recurrent and persistent coughing or wheezing or tight chest, congested chest. Often it's worse in the nighttime.
Right.
So a parent will say, my child was so sick last night, coughing through the night, heavy breathing, and then as the day warms up and maybe by midday it's very warm and nice, the child looks completely fine and the cough has disappeared. So the typical asthma behaves like that, where you'll have a few hours the child looks quite unwell, and then after a few hours it's as if it just completely disappears.
Right.
And yes.
And is it a condition that a child is born with or it's acquired? Because in most cases you see a small child is really coughing. Can we say, okay, you can answer that first.
So in the first year of life, you will rarely, the way the lungs are designed, you will rarely diagnose asthma in the first year of life. That in the first year of life, babies often get coughs and colds. They are very vulnerable because their bodies are still small and not very strong. So whenever exposed to infections or germs, homa, they're very vulnerable to go down with a homa and cough and sometimes get pneumonia. So that those symptoms in the first year of life are rarely due to asthma.
Right.
But usually in the second year of life, as the lung matures and that sensitivity to things in the environment increases, then the child who is going to be asthmatic, that's when it begins to manifest. Now you asked, are these children born with asthma? a large amount of asthma is sort of runs in the family, or it's genetically programmed. So if you have a family that has allergies, then your child is more likely to also have allergies, and those allergies may involve the chest.
Right.
So a large proportion of children, it's genetically programmed. It's in their DNA that they have this chest allergy. So it may not show itself in the first year of life, but often will begin to show itself in the second, third, or fourth year of life.
Okay, talk to us. The SMS line is 20268. Are you having a child who is having complications with the chest or even frequent coughing? This is what we are talking about today, managing asthma in children. And to help us discuss that in studio is Professor Maleche. She is an asthma expert. She's taking us through some of the preventive measures to asthma. All right, and just to make our viewers understand what we're really talking about, how common are the cases, and at what time do we have a particular time or season of the year when we experience many cases for asthma, especially for children?
Right, so that's how common is asthma in Kenya. We do have some research that has been done over the last 20 years, and it has shown that asthma has doubled. The prevalence of asthma has doubled in Kenya over the last 2 decades or so. In the 1990s, you would have in the urban areas about 10% of individuals having asthma, and in the rural areas about 5% or below, 3 to 5%. But more recent research has revealed that actually asthma has become much more prevalent. In some areas it's as high as 20%, 17 to 20% of individuals have some form of asthma, and in the rural areas about 10%. So in some settings, as much as 1 in every 10 persons has got asthma.
Right.
Yeah, and this has been, the various postulations have been put across, but one I think is our exposure to pollution, the chemicals in the air, especially from some of the things I mentioned, like car fumes. But it's not really clearly understood why there has been such an increase in asthma in our environment.
All right. And during the cold season, we experience many cases of children coughing and going to the hospital. Are we right when we say that during this, children are at a higher risk of getting this kind of disease?
So that's a good question. During the cold season, there's more humidity in the air, and this is an environment that promotes the transmission of respiratory infections. When I have a throat infection or a common cold, I may sneeze, and the virus that's there in the secretions in my nose, I will sneeze out that virus, or whatever bug I have in my throat, I would cough it out. And like if I sneeze and you're close to me, then you will inhale those germs, and they will settle in your nose and in your throat, and you will also get the cough or cold. You'll get the infection. So in the cold season, the rainy season, one tends to see much more transmission of coughs and colds, and that's why you say during this period we seem to see children having a lot of homa, a lot of cough and cold. Now, the asthmatic child will also be more vulnerable to getting those coughs and colds. However, what happens with the asthmatic child is that when their system is exposed to that virus, because their system is oversensitive, they overreact. They have a much worse homa or a much worse cough than the child who doesn't have asthma, because their symptoms are being caused not just by the germ, the virus causing the runny nose, but that virus plus the effect of asthma causing overproduction of the nasal mucus. And in the chest, you'll find that the child who has asthma, the parent will tell you, this child, akishikwa na homa, hii homa haiishi, and the homa tends to inaingia kwa kifua. So because of the asthma, the reaction doesn't just remain in the nose, but they also tend to now to produce a lot of mucus in the chest and cough. So a simple cold for an asthmatic child turns into a much more severe illness which lingers for several weeks and sometimes go to the extent of wheezing, a lot of congestion in the chest, and they often land in hospital.
Right, and Prof, reports have indicated that asthma in children, or asthma tends to cause more death in children than in adults. Why is this so?
No, I think that really asthma is a disease that is often with you for life, right? It usually starts during the first 5 years of life.
Right.
And about half of the children who have asthma in the first 5 years of life will have asthma for life. About half of them, once they pass the age of 5-6 years, their chest seems to settle down, and it's like they get used to the world, and they no longer have the asthma symptoms. Now, for those whom it lingers on into adulthood, over the decades, their lungs begin to have permanent asthma changes, permanent obstruction, and they get what we call chronic obstructive pulmonary disease, COPD. And it's actually that group of adults that have a higher rates of death from asthma.
Right.
Asthma in children can be fatal, but if the children who have the more severe forms of asthma, it can be fatal. And I'm sure if you can recall, we have had cases where a child actually gets a severe asthma attack in a school, and it's not recognized early enough and actually collapse and die in the school. And those kind of reports are alarming. So you will have a few cases of children dying from asthma, but it's more commonly fatal in the elderly than it is in children.
All right, and most children will have, or people will have this asthma attack, but many people will not know that this is an asthma attack. So how do you tell that you know, I think this is an asthma attack?
Right, so the classic features of the asthma attack, the initial signs, as I said, is just this coughing, which tends to be worse at night and gets better during the day, as the child tries to remove that excessive mucus. And but they have no fever, okay? And usually then, as it gets worse, as the attack gets worse, then the airways become congested and blocked. The child now starts to wheeze, and you'll see the child, having this, wheezing. And as they get tighter and tighter, you can see that they're having difficulty in breathing and in pushing the air out. And so that's the classic way. And again, even that wheezing tends to be worse. Those attacks of really congested, blocked chest tend to be worse at night, and then during the day they feel better. The other thing that helps you to tell that it's asthma is often there's a very clear trigger. The child will tell you that something like when they went swimming, they were fine before they swam, and then when they came out of the pool, they were having the asthma symptoms because of exposure to the cold. One common trigger of this reaction, of this asthma reaction, is exposure to cold.
Right.
So you will often have a very clear trigger. Either the child was exposed to swimming, or maybe that evening was very cold and they played outside in the cold wind. By the time they were coming in to sleep, they were coughing and wheezing. Or another clear trigger could be that somebody, they cooked with a kerosene stove, or somebody was smoking in their presence, or somebody used a very strong perfume, or sprayed a strong doom.
Right.
They say that as soon as I smelled that thing, I started to have the symptoms. So you often have a very clear trigger, as opposed to a homa, which comes on pole. And then the other way you can tell that it's asthma is that it tends to, linger for for several days, but it tends to respond to specific medication.
Right.
Yeah, they say they get immediate relief when they get certain asthma medications like Ventolin, inhaler. Yeah.
And doc, are there some conditions, other conditions that are mostly confused with asthma? For example, how do you differentiate between asthma and bronchitis or just a nasty cough?
Yeah, that's a very good question. So those are the way asthma presents. There are many other conditions that actually present in exactly the same way. So a simple upper respiratory tract infection will often present with that cough, okay? And if it gets worse and gets into pneumonia, if the infection goes into the lungs, you will have a very severe cough, a lot of congestion, difficulty in breathing. So, but you will know that differentiate an infection from pure asthma by the presence of fever.
Right.
So when there's an infection, they will usually have fever, and they will usually be feeling generally worse than the patient who has just pure asthma. With an infection, that's the patient will usually be feeling really really unwell. The child will look weak. They're sleeping. They're dull. They have no appetite. Whereas the asthmatic child, much as they're coughing and wheezing away, you see that asthmatic child seems to otherwise be happy and running around. Bronchitis is a common, what we say, differential diagnosis.
Right.
Bronchitis means that the airway, bronchus is airway. So bronchitis means inflammation of the air pipes. And it's also caused by an infection that has gone down into the air pipes. It's a bit different from pneumonia. And bronchitis also, you have swelling. The infection causes swelling and a lot of mucus secretion. Now with bronchitis, when that individual coughs out the mucus usually is yellow. Yellow shows that there's infection. Whereas if it is pure asthma, the mucus that they cough out is very clear, either water or whitish. And that's another way you can differentiate bronchitis from asthma. Bronchitis, mucus can be yellow or it can be green.
All right.
Now the challenge with children is small children, they don't remove that makohozi. They tend to cough, and it comes to the throat and they'll just swallow it. So it's more difficult to appreciate that because they don't actually cough out the sputum. A 4-year-old will not remove that sputum so that you can tell the difference. Bronchitis can have low-grade fever, but sometimes you just have this persisting infection in the bronchi that doesn't manifest with fever.
Right.
Bronchitis is rare in children. It tends to be more common in adolescents and adults.
All right.
Yeah. So usually you hear a wheeze in a child who is above 1 year. It's more likely to be asthma than to be infection.
All right, and that question was from one of our viewers. She's called Elizabeth from Nairobi. I hope your question was well answered by our prof here in studio. All right, it's now time for us to take a very quick break, and when we come back, we will be looking at treatment and managing asthma in children. Keep tweeting, keep sending those SMSs and calling. The SMS line is 20268. The call line will always be displayed right on your screen. We will be back shortly. Stay with us. All right, welcome to this second and last part of my doctor show. Remember, we are talking about, for those who are joining us for the first time, we are talking about asthma in children. We've already talked about what asthma is, some of the causes and some of the symptoms for asthma. This is the time that we will be looking at some of your questions. I can see quite a lot. Keep sending those SMSs and calling. The call line is displayed right on your screen. The SMS number is 20268, and in studio is Professor Obimbo. She is taking us, she's an asthma expert. She's taking us through managing asthma in children. Welcome back.
Thank you.
All right, so when we were talking about some of the signs and symptoms for asthma, and just before we went for a break, we were talking about some of the complications or conditions that could be confused with asthma. And one of the viewers here is asking, is asthma related to eczema? That is one. And then you can also answer Koech. He's asking, how do we prevent asthma from newborn babies? I think we'll be looking at the prevention. But before we get into now the treatment, do you we have another condition here, eczema. Do we have any relationship between the two?
Okay, that's an excellent question. So eczema, which as eczema is skin allergy. So some children have, they get rashes on their skin. Sometimes it's a reaction against things coming in contact with the skin. Sometimes it's in reaction to taking a food which they're allergic to. So that's eczema. As I said earlier in the program, asthma is for a large percentage of children with asthma, it is an allergy of the chest, right? So the two are related. And children who have eczema are more likely to also have asthma than a child who doesn't have eczema. We have something which we call the allergic march.
Right.
And it's a very interesting phenomenon where children who have that genetic predisposition to allergy, it runs in the family. In the first months of life, the first way the allergy shows itself is eczema. And these babies will have rashes on the cheeks. They'll have what we call a cradle cup.
Right.
So this area is very, very dry and flaky. And then as they grow older and they move from mom's milk to like cow's milk, they start to show that they are allergic to cow's milk or other proteins. So the first is skin allergy, and then it marches to food allergy, manifests as either colic, either take cow's milk, they have a lot of gas, they're uncomfortable, and or it may be allergy to meat.
Right.
And then as they grow older into the second year or third year of life, then it marches to nose allergy. So they now begin to manifest with that constant runny nose. You sweep near them, they sneeze a lot. We call it allergic rhinitis. And then by 3 years, that nose allergy, then it marches to asthma. That's a typical allergic march.
All right.
And by this time, often the eczema, the skin has settled down, and the food allergy has settled down a bit. But now you're seeing them with nose allergy and chest allergy. So
Right.
eczema and asthma are related.
Right. And Doc, there was somewhere an article I was reading, and it was saying that asthma can go away after some time. Is it true?
Okay, yeah. In fact, many times when I'm handling children with asthma, because it can be quite a distressing illness, you know, it keeps recurring. This child is always coughing. This child is always, I'm always in the, you know, in the hospital. So parents often ask me this question, that this thing, is it going to, how long is it going to last? So there are different patterns that asthma takes. There's that child who begins to have the coughing and wheezing in the second year of life. And this child may cough and wheeze for a couple of years up to about the age of 6 years. And then as their chest becomes bigger, their airways grow larger, then, and perhaps I could use the term, their body gets used to the world.
Right.
It becomes less and less sensitive over, to these things. Then the asthma appears to disappear. So there are a percentage of children who it behaves like that. It's present up to the age of 5, 6 years, and then it disappears. But then there's another group of children who the asthma usually starts at about 3 or 4 years, and those children, it tends to continue throughout into the teenage years.
Right.
This is what you call the later onset asthma. In general, overall, approximately half of children with asthma will not, it will not continue into adult life, but half of them, it may continue into their teenage years.
Right.
There are a proportion of children who the asthma actually sets in at puberty. They've been fine. Maybe early years they had a bit of skin allergy, a bit of nose allergy, but no asthma. And these ones are the more late onset asthma. It sets in at puberty because of hormonal changes in the body, and this category of children, the asthma tends to be there right through into adulthood.
And Doc, someone is asking a really interesting question. Is it true that asthma does not affect babies under 1 year?
Yes. It is very rare to see asthma manifesting in the first year of life. And this is related to how the immune system develops. The first 2 years of life, the immune system is still developing. So that ability of the immune system to mount that allergic, this allergic reaction is mounted by certain cells of the immune system, which are attacking that chemical which the body doesn't like.
Right.
And in the first year of life, the immune system is not mature enough really to mount that strong allergic reaction. So in the first year of life, we rarely diagnose, I remember I use the word rarely, not never.
Right.
We rarely diagnose asthma in the first year of life. Usually in the first year of life, a child who is having that coughing and wheezing, it is due to a viral bronchiolitis.
Right.
Bronchiolitis, a viral infection of their small airways. And they typically wheeze. They may be sick. They usually have a bit of fever, a bit of runny nose, and if it's very severe, they may be hospitalized. It lasts for a week or two and then disappears on its own, and they don't wheeze again.
Right.
In the first year of life, wheezing is more commonly bronchiolitis. And very rarely asthma. Now, you may have that baby who has allergy in the family, and their body they have that genetic, the DNA for allergy,
Right.
who may get bronchiolitis in the first year of life. So they may wheeze in the first year of life, and then later on in the second year of life, they show themselves to have real asthma. Now, those are the ones who you might then see the wheezing in the first year of life and later. Yeah.
All right, and before we get to treatment, let's help Diana. Maybe she's worried about her baby who is 5 months, and she's asking, probably sometimes we do see babies less than 1 year coughing, really coughing. So she's asking, can we diagnose asthma at 5 months?
So cough in a baby of 5 months is rarely asthma. It is usually, the most common cause is an infection. An infection of the throat,
Right.
or of the larynx. And if the infection progresses, it can go into the lungs. And all of those, throat infection at that age, they'll have cough. Larynx, they will have cough and they may have hoarse voice. Okay, their voice becomes very hoarse or
Right.
disappears. Or if it goes into the lungs, they will be coughing and they'll be now very sick and out of breath. And so at 5 months of age, it is rarely asthma. It's an infection, and the child should be seen by a doctor and managed. Yeah.
All right, and we want to get to the treatment and managing, and also natural home remedies on how to take care of a child who is asthmatic, or to prevent the child from getting an attack. But there's really someone who is really pressed here. He's asking, hello, good people. This is exactly what I was expecting. My kid is turning 6 years tomorrow. She has been coughing too much and vomiting and not seizing. I'm confused because I always take her to the hospital, but she's always treated for homa, but cough does not end. I want to take her for checkup. Please advise.
Yeah, so you see that child fits into the classical description of there's a high possibility that particular child has asthma. And asthmatic children often get antibiotic after antibiotic after antibiotic, cough syrup after cough syrup, and it doesn't clear.
Right.
So I think it's highly possible that child has asthma. There may be 1 or 2 other possibilities that one should consider, but definitely that child should be assessed by an experienced clinician for asthma. In the first year of life, I forgot to mention, that 5-month-old baby who's been coughing and coughing, in those, the first year of life, another common cause of that kind of cough is the baby who tends to regurgitate their feeds. There are some babies who are born with the muscle at the top of the stomach is not really firm.
Right.
And so whenever they feed, then if the stomach is full, the milk tends to come up to the throat, irritate the throat, and they cough. We call this reflux, gastroesophageal reflux disease. So what's in the stomach tends to escape that loose sphincter and go to. So reflux, and this kind of baby, if your baby it tends to cough a lot after feeds, or after you fed them and you lie them down flat to sleep, they immediately start to cough, and they tend to vomit out whatever they've just fed a lot. That child is likely, there's a possibility that child has reflux, and that is what is causing the cough, as opposed to an infection like bronchiolitis.
All right, and before we get to some of other questions here, let's get to treatment for asthma, or someone who is a child who is asthmatic. And don't forget to include home remedies for this. How do you manage a child who is asthmatic?
All right, so the first step of managing asthma is understanding what the causes are and what triggers that reaction, that the asthma cough or the asthma wheeze in your child. And where possible, avoiding or minimizing the exposure to those triggers. So, as I said, some common triggers are house dust mite.
Right.
In fact, one of the commonest allergens is house dust mite. So, house dust mite tends to hide itself in very thick carpets, and it tends to hide itself in fluffy, if you have very fluffy furnishing, like the fluffy blankets, or if you have a very crowded, congested room, those bookshelves with books which accumulate dust.
Right.
Yeah? So if one can minimize exposure to house dust mites by avoiding having those heavy carpets, instead of having a very fluffy blanket, have a cotton duvet. Those old mattresses, which have been there for years, especially if a child has wet the bed, and that mattress, you might take it out to air, but the house dust mite loves to live in those old mattresses. That can be another cause of continual exposure to allergens. So make sure you get rid of those mattresses which have been urinated on, and try and cover it with a Macintosh. Old pillows, those old pillows which you 5 years old, and those house dust mites, they love to live in there. So make sure either the child can do without a pillow completely, or if use a hypoallergic pillow. And then the other thing is sleeping next to a window, drafts of air. At night, if they're sleeping next to a window which doesn't close properly, and there's that wind, that cold wind triggers, remember the exposure to cold air triggers the asthma. So make sure your child's bed is not close to the window. Having pets, like cats especially, the fur of cats can trigger asthma. The fur from dogs can trigger asthma, so don't have those pets in the house.
Right.
Or get rid of them altogether. And then mold, if you have a wall, some of these old houses where the plumbing is inside the wall and it seeps, and you have damp walls, and then you get mold. Mold is another trigger of asthma. Avoiding to have pollution in your house.
Right.
Yeah, it's simple things like you're parking your car with the exhaust. Every time you start that car, all the exhaust is coming in through the door into the house. So minimizing exposure to pollution. Don't cook with a kerosene stove or a makaa inside the house. Let it be outside, or use cleaner cooking fuel. So minimizing exposure to those allergens. Now you can't. The other common ones are tree pollen and grass pollen. So having long grass or around the house is if you can minimize exposure to that. So that's avoiding the triggers. If it's very cold weather, avoid the child going swimming. Okay? Avoid the child playing outdoors when it's very cold. They can play outdoors when it's hot, but avoid exposure to those cold winds. Now, the second line of treatment, of course, is medication. And we have excellent medicines for treating asthma in children. The best delivery of those medicines is through an inhaler. Because the problem is in the lungs, we have inhalers that you will spray the medication into what you call a spacer, and the child breathes in the medicine. It goes straight into the lungs and goes to those cells in the lungs that are overreacting and stabilizes them and tells them, stay cool, don't overreact. It prevents that asthmatic reaction. So in asthma, inhalers. Now, if a child is having symptoms almost every week, That's what we call persistent asthma.
Right.
Children who have persistent symptoms need to be on what we call a controller inhaler. Now, the controller inhaler has a a drug that prevents the asthmatic cascade, the asthmatic reaction. And the child is supposed to take that inhaler every day, and it prevents the child from having frequent asthma attacks. Now, the second important drug or inhaler is a reliever, which contains a different molecule,
Right.
which you use when the child is having the asthma attack, when they're having the coughing, or they're having the wheezing or the congested chest. And you use that inhaler whenever the child is symptomatic. In fact, I normally tell patients that this inhaler is now your baby's, it's your cough syrup for the asthma cough. Throw away all those cough syrups, you use the asthma inhaler. And what that does is when the child, you spray, the child inhales it, it now causes the airways to open and stabilizes and prevents and also reduces the mucus production. So inhaler medication for asthma
Right.
is the way to go.
And one of our viewers was asking, apart from inhaler, is there anything else that one can be used, or is there anything else that can be used when it comes to managing asthma in children?
Well, yes, there are some drugs that can be taken by mouth. The same inhalers, for example, probably the name that people know very well is Ventolin.
Right.
Yeah, Ventolin syrup. And sometimes parents who have asthmatic children will know that magic syrup, Ventolin, when I give the baby the Ventolin syrup, the asthma settles down. So, but however, we have improved on Ventolin syrup so that instead of using Ventolin syrup, we can use a Ventolin inhaler. But some people find it very cumbersome to use inhalers. So there are one or two different other medicines which can be taken by mouth, which block the asthma pathway from a different chemical pathway. And one is called Montelukast. It's a leukotriene receptor antagonist. It blocks one of the allergic pathways, okay? And so Montelukast can be used instead of the inhaler, the first inhaler that I described, that sort of controls the asthma, prevents recurrent attacks. And for some children, not all, but for some, one can manage them well with Montelukast, and they can take that once a day, and it does the same thing as the controller inhaler. And so for older children, again, there are other molecules called theophylline, and these are what we used to call Franol, more commonly, not used much in children, but teenagers and adults who, for one reason or another, cannot do well with the controller inhaler, or they cannot do well with the Montelukast. That's another alternative drug that can be used, but only in the milder forms. The children who have the most severe, moderate to severe asthma, you really cannot get good control without using those controller inhalers.
And Doc, other than seeking medical attention, do we have natural ways of managing an asthmatic attack?
Natural ways of controlling asthma. I think the first, what I said, preventing exposure to triggers.
Yes.
That is really the natural way of preventing. But once a patient has got the asthma attack, you have to treat it.
All right.
Remember, asthma can kill.
So we don't have anything like first aid or something. You have to treat it.
The first aid, usually when they've got the attack, okay, remove them from the trigger. Perhaps it's you're cooking with your kerosene stove, you forgot. So move them out of exposure to those fumes. Perhaps it's a perfume that dropped in, you know, remove them from that trigger. That would be the first thing, okay? Get them into a warmer room. If it's exposure to very cold air, maybe trying to warm up the room so that the lungs, because they breathe in cold air, they've reacted. Now, as they breathe in the warmer air, they begin to calm down.
Right.
So that would be, if cold, exposure to cold was the trigger. So those are, it's basically removing them from exposure to the trigger so that you don't have continual acting up of the asthma.
All right, and Doc, as we wind up, Let's hear what one of our viewers is saying. For someone who is experiencing wheezing, a painless wheezing in the mid-20s, are those some of the symptoms of a development of an asthma? Maybe you could answer him and quickly, because we need an emphasis on really real symptoms for asthma, because there's really a big confusion between asthma and other conditions. Maybe you could answer him whether that painless wheezing could be symptoms of asthma, and what are the extreme signs that you know what if your child is going through this, then this is automatic an asthmatic attack.
Okay, so the key words are recurrent,
right,
persistent, okay? So you're wheezing. Is it you're getting attacks of wheezing and it subsides, it comes back again, subsides, and it doesn't seem to go away. So recurrent, persistent wheezing is often accompanied by cough. And the third symptom is that feeling of tightness of the chest as it gets worse. So congested chest, you're having difficulty in breathing, which again waxes and wanes. It's not there 24 hours, but it gets worse, especially at night, and better during the day. That would be characteristic asthma. And do you see very clear triggers that when I'm exposed to this, I get the attack, okay? That helps you to know that this is asthma. If it is continuous wheezing throughout the day and night, there's no clear trigger. It's not related to running or doing exercise. It's not related to exposure to cold or something. That is less likely to be asthma, and it may be another, there are a host of other conditions which I think a doctor would be able to diagnose for you. Yeah.
All right, and a parting shot to our viewers as we wind up, maybe what are some of the ways that mothers and fathers out there, they should be doing to protect their children from getting asthma? So
how can you minimize your child getting asthma? Well, if it's genetic, it is there, it will come. But you can minimize their severity and the frequency of their attacks by living in a healthy environment, breathing clean air, right? Avoiding pollution, avoiding living in an area where perhaps you're next to a very dusty road, or next to a construction site, or next to a factory that's belching, improper. So healthy environment, minimizing having pets in your house, minimizing having things that collect a lot of dust in your house, and of course eating healthy. Eating a balanced diet with lots of fruits and vegetables, the vitamins and the minerals to keep your immune system healthy.
All right. Yeah. Professor Elizabeth Obimbo, thank you so much for making time for us. That's all the time we had for the show. It was interesting. It was quite educative. We look forward to having you again.
Thank you. Thank you very much for inviting me.
Okay, thank you. And that's all the time that we had for the show today. Thank you so much for being part of this show. Thank you for your views, for your SMSs, and for your company. Key things here to note: the doctor has said you should ensure that your child does not sleep next to a window or in a dusty environment. That is what you should be looking forward to. In case you missed our previous episodes, do download them from our YouTube channels. For those who are asking what my name is Purity Museo. Take care.